Introducing health and wellness advocate, veteran international real estate investment expert, author and speaker, Adiel Gorel.
Health tips, fitness tips, nutrition and well-being, world-class experts, all right here on my podcast, The Adiel Gorel Show. Hi, everybody. It's a great joy to be back here with you. I'm particularly excited today. We have a fascinating topic, and I'm very much looking forward to learning from Dr. Jeffrey Gross. Jeffrey Gross, so sorry, I am a foreigner. Dr. Jeffrey Gross. Dr. Gross, it's great to have you here.
Thank you so much for having me. Please call me Jeff. I want to be able to, make myself available to yourself, your listeners, and help educate and help people along the way.
I'm going to go ahead and call you Jeff. Welcome to the show. And again, your topic and your specialty is fascinating to everyone in the world these days and getting more and more so. So why don't we begin with your own background? How did your own journey in medicine lead you to stem cells?
We can thank my patients in part for that. As I was practicing traditional neurological surgery with a fellowship in the spine. So I took care of neck pain, back pain, disc problems, pinched nerves, injuries, things like that. And we would offer treatments like therapy and medicines and injections in the spine. And then if all else failed, sometimes even surgery. And we were always trying to make that the very last option for people. And patients helped that. They would come in and say, well, the injections and the therapies didn't help enough. They were temporary, but I'm not ready for surgery. And I would say, great, because I really didn't want to offer it to you unless we had to. But I understand you still have symptoms and your quality of life isn't perfect. And they would say, well, how about lasers? How about this? How about stem cells? And you hear that stem cells enough time, and chance favors the prepared mind. And because I have undergraduate background in that area, that molecular cell biology, and I know you spent some time at Berkeley Haas, and I have my undergraduate, so go Bears. I'm from Berkeley as well.
Actually, I'm the enemy. I'm a Stanford guy.
That's all right. We get along well. But I thought I saw something on your website about.
I did do work in Berkeley, and I spoke at the Haas Business School, and I like Berkeley, but I'm the enemy. I'm from.
That's okay. We can come together once a year and enjoy the big game together.
Exactly.
But I decided instead of going to the same old spine surgery conferences every year, where really nothing was changing, I would go back and see what had happened in all those decades. And a lot had happened, and most of it did not happen in the US. It had happened in Europe and in Asia and other places, and the US was just slow to adopt it. And there's good science, good evidence-based medicine is the phraseology we use on these studies. And, for a long time, professional athletes in the US would leave the country to go get these treatments. Well, now we have them here. So I retrained, I re-educated, I adopted regenerative medicine to add a new tool to offer people. And it has blossomed in the last 7 years to so much more than that. And it's almost all I do now. And I love it. It's a version 2.0 of my practice. And we even treat people from Stanford.
Oh my God, you do that? It's really come a long way.
Yeah.
Okay, well, let's take it back one step. Stem cells.
Yeah.
If I, understand it as a layperson, and you can explain more,
right.
Stem cells are there when a baby is born,
right?
And even maybe in utero, and they create all the parts of our body as needs to be. In other words, they have the flexibility. Can you talk a little bit more about that?
Yeah, I mean, we hear the phrase stem cells, but we should break it down a little bit for the purposes of, getting smarter about it, because it's something that's available. We should know about it. So stem cells are the basic building block cells that create us in the first place. All of our cells stem from those cells, hence their name. So the most powerful stem cells are when we are a new embryo. We were just a fertilized egg. Those are called omnipotent stem cells. They can make a human. That's super powerful, right? As the fetus is growing into a human shape, those cells can't make a whole human. They become less powerful, but they're still growing a human. They're called pluripotent stem cells, not omnipotent, but pluripotent. And they can grow a limb, and they can create whole organs. And some species preserve the ability to induce pluripotent stem cells. For example, a lizard can regrow its tail, a starfish can regrow an arm, and that kind of thing. So we're learning from those. But when we're born, when the fetus finally comes out and becomes a baby at that moment, most, if not all of those cells that we use to grow and develop, and we use to maintain, replace, heal, and restore as an adult in our stem cells that we still have, are called multipotent. They cannot make a limb, they cannot make a human, but they can replace a liver cell. They can change your skin cells, which are happening all the time. They can go to an area of injury and help heal it. And the whole basis of regenerative medicine or stem cell-based medicine is to tap into that knowledge and use it strategically in people who need additional help.
So I recall very vaguely when my 20-year-old son was born, we were offered something by bank, so to speak, called a blood cord registry.
Right.
And we could retain some of the fluids. And again, I'm speaking like an idiot right now, but you understand what I'm talking about. And I actually said yes. So at least in theory, we still have an account there with the blood cord fluid or whatever it is that came from my son. I assume this is related, isn't it?
It is. And what you were offered and what you did, it was a very basic early manifestation or offering, which is now, there are a lot of layers you can grow from that. When you did it, and still today, the main reason you did that is, God forbid, your child gets leukemia and has to have his entire bone marrow zapped out with chemotherapy. You would not have to find a donor matching to replace that bone marrow with a bone marrow replacement. You would have the actual stuff from the original factory. So now, can you now use that for other purposes? Hell yes. You can use it for your child, your son. You can use it for yourself and others. And the reason you banked it's there for that purpose. So, and now you can bank these materials and use them for all kinds of things. And you can actually, as an adult, have your cells harvested, the stem cells separated from them, and go into a bank. Although that may not be the most efficient thing to do, both for the number of steps and cost involved, and because your cells, like mine, have had decades of exposure to an inflamed world. We would rather have brand new, fresh out, uninflamed, naive stem cells. So there are other ways to do that.
So again, we are all exposed to the people who care about health and wellness and longevity. We are literally bombarded with this now everywhere.
Yeah.
From people that harvest it from themselves and, inject it into all kinds of places, some of which I might not even mention here, or maybe I will if I get a little more comfortable. But I mean, you seem to talk about using it in the context of pain, resolving pain.
Yes, that's probably the most common thing I do, because I came from the musculoskeletal world, the moving parts, the joints, the spine. Most of my patients are already, in that area. So, and when we deal with joint problems, the earliest manifestation is pain. So you are correct for those reasons.
So let's take a person that has neck pain. I'm saying neck on purpose because I don't want to go to the back, which is a very large place. So somebody comes to you when they have neck pain. Maybe it stems from just a muscular, contraction. Maybe they got hit. and the muscle's seized up and it doesn't really release, that's probably very simple. Or maybe one of their discs is a little bit, degenerated. So let's say that it is a disc.
Yeah.
How would stem cell therapy help?
Well, we would take each individual and help identify the source of the pain before we start throwing stem cells at the person, right? We want to be very precise and targeted. There are some clinics that just give you stem cells and say, oh, they'll go to the place where you need them. And you could do that. You can go right now to Mexico or Central America and have IV stem cells. And
IV stem cells. So they
Right.
get into your bloodstream,
Right.
and the assumption here is that they will find the weak spots. Okay, I
Right.
understand. I'm assuming
Yes.
that's not what you guys do.
It's not, although we do have some patients that we treat with the intravenous offerings and not just stem cells. Maybe later we'll talk about the other options. We do that for people with overall body inflammatory issues. But if we're targeting a certain area, like you said in your example, neck pain, they've got some muscle pain, we want to identify the problem. We want to examine the patient. We want to ask lots of questions, take a complete history. We want to look at the patient's lifestyle and epigenetic factors, meaning are they exposing themselves to pro-pain inflammation all the time through diet, through lack of exercise, through toxin exposure like smoking or too much drinking or something? Are they not doing all the good, healthy breathing and restorative sleep and nutritional things and hormesis, a slight stress to the cells to build resilience like fasting or time-restricted feeding, hot sauna, cold plunge, high-intensity exercise, all kinds of things. And that helps the whole body because in one way, it stimulates our stem cell activity. But let's say the patient's optimized and they have a specific thing. We may order labs. We may order an imaging test like a high-quality MRI to study any areas of inflammatory pain. We will look very closely to help identify exactly the source of the pain. And sometimes we do a little numbing block to see if we can really temporarily remove the pain to prove where it's coming from or confirm. And if it's persistent and they're not responding to, low-level, inexpensive treatments like stretching, strengthening, massage, acupuncture, maybe chiropractic care, etc., then we might consider as an alternative to cortisone shots or steroid shots, which might help in the short run, but can cause advanced degeneration in chronic use, then we might look to inject the stem cell-based regenerative biologics because they are so heavily anti-inflammatory and reparative.
Okay, so let's say, I'm just making up an example, which could be a silly one because that's not my field at all. Let's say you did all the diagnostics and something is wrong with how C7 sits on its base. It's tilted, something there is a little bit degenerated, and that is causing the pain. Are you going to inject stem cells right into where that vertebra is?
Essentially, yes. That would be the goal under image guidance in a injection room under sterile conditions with a little twilight sedation. That's exactly what I would recommend.
And let's say that this is done, and let's assume the optimal scenario of healing. It was done well, you guided it very well, it went to where it should be, and it will heal according to what you most rosily expect. What would it look like?
Well, initially, we'd hope for an anti-inflammatory effect where the pain would come down significantly while the regenerative piece begins. So regeneration doesn't happen immediately, but because these biologics are so heavily anti-inflammatory, like a steroid shot, usually pain is improved. And people think, oh, I'm healed, but they're not healed yet. They're just feeling better. And then over the months, we would monitor the patient, and I would expect some improvement in the remodeling of the joint, the cartilage, the maintenance of that joint, improvement in the lubrication fluid in the joint, things like this, until the joint behaves more like a normal joint. It's less inflamed, it's more lubricated, it moves smoothly. And that is what we see through the regenerative process of the joint by tapping back in to the cells and the behavior of the cells that made that joint in the first place. So it's like putting in a new factory order.
So you said two words that really triggered me in a positive way, that is. One is the word remodeling, and one is the word regenerative. In other words, we're talking almost, I know that there is a process and I know, but it's like a magic wand. In other words, there was some degeneration between the discs, there was some tilting, things were a little tired, chipped maybe a little bit. Basically, those two words to me, remodeling and regenerative, mean that those stem cells are actually going to go and say, here is how it should be, here is how it is, and we are going to bring it to how it should be. Is that true?
Yes, we see that quite often. I'll give you a secret, though. The stem cells or the biologics you receive, they stimulate your cells to do the work. Your body does its own natural healing. Sometimes it needs re-encouragement. And remember, your body generated that anatomy in the first place. And through stimulating through stem cell type biology, your own cells, you can regenerate what it once generated.
So basically, again, going to the magic realm of you have a magic wand and you say, I'm going to fix you with a magic wand and it'll be like it should. So the question which you just answered is, how do we know what it should be? You're saying well, the body knows it. The body built it. Your own body knows what it should be. So the reservoir of knowledge of what it should be when it works perfectly is inside of you. The stem cells are the stimulus to make it happen. Is that true?
That's correct. The other stimuli would be the mechanical and cellular nature of the anatomy. So how you use your neck, how you move it, the weight of your head, that stimulates those areas to build that joint in the way it's anatomically designed for our species. That's, as you read in Gray's Anatomy, that's exactly how it fans out. And that's how it would remodel under the proper stresses. Now, if we never correct the tilts, it may not remodel perfectly, but often it remodels adequately enough to remove the pain and improve the function.
Now, in this example, I'm running with this example to have a better understanding. In this example, you went in, you know exactly where you go, you injected the stem cells, pain has been relieved relatively quickly, remodeling took maybe a month. Now, during that month, or the 2 months to follow, or 3 months, whatever period of time, is there a need for a second shot, a third shot? How does that work?
Usually not. For this type of application, we try to do it one and done, but it does take often many months, sometimes 6 to 12 months, depending on the joint. Certain joints respond quicker, like knees and base of the thumb. Ball and socket joints tend to take longer because of the mechanical nature. So the shoulder and the hip take longer, but they happen.
Nevertheless, the way you talk about it, and again, this is not the first time I'm exposed to it, but when my brain processes our conversation, there are little fleeting thoughts of, this is magic. It's magic. I mean, it's not really magic, of course, but I mean, it's so promising. And so, I mean, how does that bode for the future of humanity, assuming that the development in the usage of this technology is only making up here a quarter of the way that it's really gonna be?
Oh, yeah.
What's gonna happen when it's fully there?
Well, first of all, I find this no more magic than a single fertilized cell creates a human in the first place, right?
Absolutely, I agree.
So, we're on a trajectory, as you alluded to, for great things here, including, for example, there's an area of work where you can induce these cells, these stem cells, backwards along the embryonic lineage from multipotent to pluripotent. And that's where we're going to learn how to regenerate a finger or a limb. Okay. And we're also using that strategically to help fight cancer. We've got some other projects, even here in my clinic, we're working on to help address cancer using stem cells and stem cell derived signaling particles called extracellular vesicles or exosomes from the immune system to help fight accidental cancer cells or help fight cancer. So we've got other approaches with, sort of a little bit of an engineered exosome from a stem cell to help add mitochondria to cells to help fight frailty, improve muscle mass and bone density. And aging populations need to maintain their muscle mass and bone density and keep moving. That helps the brain. It helps with longevity and health span. So we have amazing things that we're working on right now that will be coming shortly.
Am I correct in assuming that a certain type of physical activity will actually increase the number of mitochondria in our cells? So here you're saying that the injections of stem cells can act as an accelerant of this process. I'm not saying the person shouldn't exercise, but even if they didn't, more mitochondria will be available.
Right.
Yeah.
Not only more mitochondria, but more youthful, efficient mitochondria, so because they renew and regenerate and go through what's called mitophagy. And if you have a younger population of mitochondria, you have effectively younger cells and therefore an effectively younger you. And that's what we call biological age, because you might be 50 on your calendar, but you could be 35 biologically with this better mitochondrial population.
Now, a person comes to you, again, I'm running with the same example so far, the little neck pain. For people who have neck pain, it's not little, the neck pain. And where do you harvest the stem cells from?
So as I alluded earlier, there are multiple sources. You can harvest them from yourself. You can have them banked. You can have it banked from a child's cord blood or umbilical cord. But we have a more efficient process where we can get these from C-section donors. So there's mothers who have a planned C-section and they become donors. They're not paid for this. And they can be screened ahead of time. And we're using them from donors who have not had the COVID vaccine. And that, although that has all kinds of political underpinning, I don't mean it to. It's just we don't know enough, so we're not using those. And these are donated. They're sent right to FDA compliant and certified labs who screen them. They test the samples, and then I purchase them. My clinic purchases them as like an end user. So they go right into my minus 30 centigrade freezer, and they are basically frozen from the time they're collected. So they're day zero, fresh out, fresh frozen, either stem cells or stem cell derived exosomes, growth factors, purified amniotic products, Wharton's jelly, all the good stuff that makes a baby. So that's where we get them, and they're easy to use. You don't have to harvest anything. You don't have to worry about anything. They're safe and effective.
So why only in a C-section situation? Why not regular birth? There's still a lot of fluids and placenta and stuff. Why only in a C-section?
Because technically a vaginal birth is a non-sterile situation. There are bacteria, and you don't want to have an intravenous or neck or joint injection of something that's not sterile. And you don't want to sterilize the material because you kill the active living cells and exosomes in there. So a C-section, they prep the mother with either iodine-based antiseptic and before they make the incision, so it's sterile. It's considered aseptic.
I understand. Now, let's say that we are talking about those stem cells that you purchased. They're now in your freezer. They're brand new, spanking new, but will they match? Is the donor going to match the recipient? Do you need a match? How does that work?
You don't, even though you do in a full bone marrow transplant recipient. For use like this, no, the stem cells are immunoprivileged, meaning they don't have a lot of cell surface markers to identify as self, because in your body, they haven't decided what kind of tissue to be yet. They're waiting to be called upon. Oh, we need some liver cells. Hey, the kidney needs some help, So those cells are sort of naive and neutral, and they're sort of like the Switzerland of cells, if you will. And so there really isn't a rejection. It's a theoretical thing. I've never seen it. I've never read about it, even though everyone talks about the theoretical side. If you go even further, instead of using the stem cells and use the business end of stem cells, these exosomes, they're even more naive. They're completely immunoprivileged. So there's never been a known reaction to those in that way.
Well, that's very heartening to hear, because there is a very significant amount of C-sections happening in the world, and you're saying that the donors are not being paid.
They cannot be an effective, at least here in the States, the donation requires non-payment.
Non-payment.
Right, not a donation.
I understand. I think I understand where that's coming from, because you don't want to encourage an industry where, like in the third world, God forbid, I don't want to put it in the same bucket, but there are people who say, I'm very poor, I'm going to sell a kidney. You don't want to go to that.
Correct.
Right?
We don't want any ethical or moral question at all, or even encourage that. And because there already is, at least here in the States, some people do have more children. They're encouraged to have more children because of government handouts and things. So we don't want that in this field.
I understand. Now, let's expand the horizon from the United States to countries that have different rules. And does it exist in other countries? I'm just curious.
Yes.
That people will say, okay, I'm due for a C-section. I already know that. And I want to sell it. But hey, man, I mean, you're in the US, you're rich doctors, rich patients. I'm a poor person here. I want to sell it. Does that happen?
I don't know is the answer. And I don't use any biologics from outside the country. So I can't.
Well, not you. But I'm thinking about trends for the future. I mean, I know that some of it sounds a little bit like too futuristics in the way that nobody likes. Once again, the rich people get all the goodies and the poor people there's a lot of bad stuff there. But again, just out of no bias, just thinking logically, whether that could become a trend.
Yeah, and it may already be one in some circles. I don't have access to those circles. I'm not looking for access to those circles. But yes, there is the possibility of some nefarious activities using these materials. You read about it, questionably in some Hollywood circles and the other nefarious groups, very possibly.
Okay, so now let me take the question in an extreme direction, from talking about the boundaries of the US and the rules and the laws of the US. Suppose you get interviewed on this podcast, on other podcasts, you get exposure, things get viral, and my goodness, your clinic gets a gigantic amount of people, because everybody has some pain, everybody has something they would like to work on, and you are inundated. It's a great problem to have. You have patients way beyond you ever expected. Now, you're saying that one of the donation sources is a C-section. Now, are there going to be enough donors to satisfy a large demand?
Oh, yeah. I mean, listen, a single donation is probably 20 or 30 doses of material. So at this point, I see no strain on the infrastructure to be able to supply what we need currently. Plus, if people start banking more of their child's umbilical cords and things for themselves, there'll be plenty more. I just don't see that as a current strain on the system.
Okay, well, that's very good to know, and that's very promising and hopeful. Now, from the self-help gurus, not necessarily, MDs or trained in medicine, I have seen at least 2 males who say very proudly, by the way, I, injected stem cells into my penis. I mean, one of them was young, he was like 35, healthy, and the other one was maybe 45. But I mean, why would a 35-year-old, healthy as can be, take such a sensitive part of his anatomy and as an experiment on himself inject stem cells into his penis?
Well, first of all, because it is a sensitive part of his anatomy and he wants to keep it as sensitive as possible and as useful as possible because he's about to go from 35 to 40. Testosterone is declining at this time, and especially nowadays for reasons we're looking into. And function is not always what it used to be. And a regenerative injection in that area, which isn't that bad, it sounds crazy, but we do numb the surface with some topical numbing, and we do these things. Can improve sensitivity, function, blood flow. Maintaining the blood flow is probably the key element. The health of the vessels, because it's very vascular dependent, artery dependent. So it's a simple procedure. It's really not that big of a deal.
And are there any risks? Again, this particular example struck me because I look at a very healthy specimen, 35-year-old, at the peak of his powers in every way, and I'm thinking, well, what are the downsides? Are there downsides?
Well, everything we do has risks. There's always a risk that if you don't do it in a clean way, it can be infected. The needle would hurt. It wouldn't work. That could be something. Or, you mixed it up with a syringe of, Windex or something like that. I don't know, something crazy. But no, I mean, the risks are heavily, heavily mitigated. And, you said earlier, why would he experiment on himself? I mean, that's what we do. Everything in medicine is an experiment on a person in some way. Now, we do it on a body of knowledge. And this kind of penis shot is a very frequent thing in the world. And there's also a female variety, not to just pick on the men here, where we inject the vulva and the clitoral structures and the vaginal and periurethral structures in the floor to improve, elasticity, strength, tightness, lubrication, sensitivity, all these things.
So going back inside of the bodies, you just talked about females, and you talked about injecting stem cells into the outer structures and making them function better, be more sensitive, essentially rendering these female patients more sexually functioning better sexually, so to speak.
Right.
But if you go down inside, there are things inside, the ovaries, the things that sometimes could go a little bit wrong. Do you see, or can it happen that you would go in and put stem cells deep inside to reach some of those, internal structures?
Yeah. So there are applications in the fertility realm, both for men and women. For women, I would do it intravenous. And these are women who have a known difficulty getting pregnant because of some inflammatory burden, whether it's an autoimmune problem, where the inflammation is high, or some other long-standing problem from an inflammatory burden infection like long COVID or Lyme's disease. There are other pro-inflammatory issues, exposures to toxins that we might be able to mitigate adequately enough for that person to get pregnant and have a successful pregnancy. Same with the men. We can do that intravenous. There's also a shot right into the testes for problems that involve inflammatory burden that's suppressing their ability to make successful, sperm.
What about non-sexual reproductive per se, although it's related? What about the prostate and the bladder and those structures which, at least in men, later on in life can start growing and affecting the flow of urine? How does that work?
Yeah, I have a colleague who practices regenerative medicine similar to me, except he comes from the side of urology, and he has cases where he is addressing prostate health in conjunction with the right hormonal optimization and bladder issues, pelvic floor problems, things like that. There are applications.
So if there is the case of a BPA, stem cell injection into the area can mitigate the growth, can make it shrink again? I mean, what's going to happen?
Yeah, I think you're looking for inflammatory issues like prostatitis, things like that would have potential benefit from the anti-inflammatory nature of regenerative biologics, whether it's intravenous or direct into the prostate. I would consult with my colleague because urology is a little far off of what I normally see.
So, I mean, let's take it again into a bit of an extreme place. I mean, let's say there's a person with unlimited resources financially, and they say, okay, I'm so many years old. I try to do everything right, but Father Time always wins, right? How about, because I can afford it, I will get the, IV seems to be the one that's the general.
Right.
I'll get it as a maintenance, nothing even specific.
Yeah.
If that were to be the case, what would the frequency be?
It depends on the individual. We would do some blood markers and come at this scientifically. We would look at the inflammatory markers. We would look at the person's age and size and figure out a dose. And then we would do an experiment. We would try one dose and see what they get. I personally do this on myself. I do it every 3 months or so because I have a good burst of success with my energy, my cognition, my recovery from exercise. And it starts to peter off after about 3 months or so. So I'm on a 4 times a year cycle. I am modifying the dose over time. And everyone could be different. I have a sweet little old lady who's 82 who has osteoarthritic, painful joints, and she can't do her crafts and her things at home and cook. So we did an IV for her, and she had this wonderful improvement. And then she said, "When do I do the next one?" I said, "You let me know when things start to come back." Didn't hear from her for 2 years. So everyone's going to be different depending on how much inflammatory burden they carry in their cells, how big of a response they got from the first treatment, etc.
Going back to the sweet old lady, you said you didn't hear from her for 2 years. What happened after 2 years? You did hear from her?
She called me this about a year ago, and she said, "Hey, I think my symptoms are coming back. My hands are starting to hurt again." I said, "I'm ready to see you when you're ready." So she came in, we did another IV. I talked to her a few weeks later. She felt great. I said, "Okay, I'll either see you in 2 years or if you call sooner."
Well, this is beyond exciting when you think about it, because you're talking about, again, the word miracle pops to mind, but you said so correctly, forming a whole human life out of 2 cells is a much bigger miracle. Except that miracle is very known to us, and everybody knows about birth and new babies. This is
Right.
sort of like a new miracles in a sense.
Right. Right.
But it's very exciting that you can even put people on a preventative, like you're doing. And,
Yeah.
and that is incredible. Now, going back to the harvesting, we talked about the relatively, ample source of C-sections, but sometimes you do harvest it from the person, him or herself, from their own bodies.
I have patients who have already harvested. They just want to use their own material. So we do that. We call from it. It's very expensive compared to off the shelf, but that's okay. And I have some people who just prefer it. So we would go along with that. I don't like to do the harvesting myself. Usually I send them elsewhere to get it harvested. It's labor intensive. It requires multiple steps and equipment that I don't have to have. So I don't have it.
I'll even be more of a devil's advocate and say, going back to your 82-year-old patient, if she was keen on harvesting her own stem cells, those would be stem cells that have been around for 80 years. I mean,
That's right.
would not be so, yeah, right?
They're not as active. They've been exposed to the same inflammatory stresses and oxidative stresses and bad thoughts and things in the air and water and food that we shouldn't have, that all of our cells are exposed to. So they're not the best functioning stem cells out there.
So, conceptually, obviously the best stem cells would be, as you said, right there from birth, pristine, naive, as you call them. I like that.
Right.
So, that kind of connects to a larger concept, almost silly, which was satirized in the series Silicon Valley in the form what they call the blood boy. They talked about the rich Silicon Valley magnates getting young boys to get their blood. And in fact, Brian Johnson, the guy who doesn't want to die, I mean, I don't think we want to die either, but he had a plasma exchange, not only between himself and his father, but between his young son and himself. So, I mean, in a way, getting the younger stem cells into an older body, it kind of relates to it in some way, right?
Yes, this is not new information, right? The original studies were in mice where they hooked up, they took blood from an old mouse and gave it to the young mouse and vice versa. And as a result, the old mouse started to look young again and behaved young again, and vice versa. The young mouse looked like an old mouse. So this is not a new concept. It seems nefarious when you talk about blood boys and some of the the Hollywood elite and the adrenochromes and all those things. But it goes back centuries of lore with vampires, right? Vampires drink the blood of their victims, and they do it to live forever. So this is not new. In some cultures, they they take the menstrual blood and they use it for wound care, and they eat the placenta or they make capsules out of it. And I mean, these are not new concepts. We just now understand them.
Yes, absolutely. I mean, there was a movie, I forget the name. It ended with the letters IUM. It wasn't Ethereum, which is, I think, a currency, but Elysium, maybe, with Jodie Foster and Matt Damon. And it was an apocalyptic story of the Earth as being very toxic, and all the population lives on the surface of the Earth, and they live a pretty bad life. But the very wealthy are on a ship out in space, which is enormous, and they can heal anything. And again, those are all the folklore view of what we're talking about. Of course, ideally, it's not only for the wealthy. And talking about that, I mean, if somebody comes to you and says, Jeff, I want to get a preventative, I'm fairly healthy, I want to get an, IV, and let's see where it goes.
Yeah.
Is it prohibitive in cost? You don't have to say what the cost is.
I have no problem saying it. I think we should get it out there because I think there's a myth that it's beyond comprehension, or you have to leave the country here or something like that. And before I answer though, your concept about the space travel, this is a big push now. We're talking about trips to Mars and having banks of stem cells on these trips for whatever reason, right? I mean, we're already ahead of that. That's a big push in the arena of regenerative biology. But the cost, like a low dose IV, is under $4,000 of the exosome material. Exosomes are so abundant because there's so much amniotic fluid that they're much less costly than the stem cells, but they do the work of the stem cells and they penetrate tissue better. They cross the blood-brain barrier. So stem cells are too large. Stem cells only last about 10 to 14 days in your body, but the benefits last much longer. And the reason is those stem cells are making and delivering those extracellular vesicles, those exosomes that activate our cells. So at the end of the day, we need to activate our own cells. And you can do that without stem cells. You can do it through high-intensity exercise, fasting, etc. Even yoga has been known to increase your own stem cell activity. So yeah, a low-dose IV is going to run you about $4,000 or so. A high-dose IV, you're looking at maybe double that. When we do joint procedures, we do involve an injection facility with nursing staff and anesthesiologists for the twilight sedation. So you're looking at a little bit more for that. But when you're looking at the cost of a surgery to replace your knee, the downtime, the missed work, the pain, the risks, the fact that you've burned a bridge, you can never go back, and you might need that knee replaced down the line again, I think you're saving a lot of money if you're looking at a $10,000 or $12,000 multi-dose knee procedure one time with a regenerative biologic compared to a knee replacement.
Well, I think it's much more than just saving money and time. I think that by not needing to go in with with a hacksaw, and cutting your joint and cutting
Right.
stuff and putting metal or some other material inside, which could have all kinds of ramifications. I
Right.
think the savings goes way beyond time and money.
I
It goes very far, more than that. So, I mean, why you mentioned low dose and high dose? Can you elaborate? Why low dose? Why high dose? When? How? Why?
Well, a young, healthy person doesn't need the kind of regenerative kick in the pants, that maybe an older person does. However, my 82-year-old lady had a low dose and did great. So we might start with a lower dose unless someone has significant inflammatory burden from whatever reasons. One, to save on cost, and two, just because you don't need the bigger dose. And sometimes we have to do dose escalation to find where it works, not unlike using a GLP-1 peptide for weight or other reasons.
Could it be that also the size of the body, like she was
Oh
a
yeah,
smaller person and female?
sure. We consider that. We consider the size of the person and the overall sort of factors that would go into figuring out a dose. At the very beginning, we were just starting at the low dose because we were being, cautious. This was new. And now that we've done, hundreds and hundreds of patients, I'm more comfortable doing higher doses. I've done, a 5x dose on myself. We've even done a 7.5x dose on people. So it just depends.
Okay, so if low dose is X,
Right.
what is high dose? Is it 5X or is it 2X or
The,
3X?
the highest we've gone at a single sitting in an intravenous is 7.5x. Now I have had people come in with joint problems, and I've done 4 different joints in the body at the same time, and we've used maybe 10 to 15x, but they're deposited specifically. They're not.
Specific.
Yeah.
Yeah, but I'm talking, IV. So
Right.
generally, the loose definition of high dose,
Right.
is how many X in an IV?
The high dose in our practice is about 7.5x. Although, in the right setting, I wouldn't have any problem going higher even for this reason. A pregnant woman is getting a dose of intravenous exosomes through the placenta daily, and she's probably getting 10x a day. So, and you look at a pregnant woman, their skin is wonderful, it's glowing, their hair is growing, their nails are growing like crazy because they're getting this dose of youth. And why is that? So the mother can be healthy and ready to care for her newborn, right? It's a survival thing.
Very
So I would have no problem. We're learning more about how to escalate these doses.
Very fascinating stuff. I mean, I'm going to ask you something you don't have to answer, but I'm asking it not because I'm a nosy bastard, but because I want to understand better, and our listeners to understand better. How old are you?
I'm 59.
59. So first, I do have to say, whether it's because of those IVs or not, you certainly don't look it. If you told me that you were 44, I would buy it in a heart. And even that is only because you come off as mature and knowledgeable and everything. But so 59, that's quite impressive. So you're touching 60, and you yourself probably eating well, exercising, doing everything right. Still, you give yourself a high dose of IV 4 times a year as maintenance.
Right. Correct.
Now,
Thank you.
again, going specific and going private, this is only you. What has your experience been? How long have you been doing that?
I started this about 5.5 years ago. I was started a lower dose, and my experience is as follows. The first dose was amazing because, my body had 55 years at that time, 54 years of inflammation. Had never been exposed to this massive anti-inflammatory biologic. So I felt sort of effervescent and buzzed, not buzzed in a drunk sense, but sort of energetic. I was motivated, had more libido. I could work out and go past my normal workouts and not be sore afterwards. I was sleeping deeper and better. It was just amazing. And that lasted a good 3 or 4 months. And then each dose after that was the same dose. It was a low dose. I didn't have as much of a benefit each time. I did notice it, but I didn't have that wow factor. And then I started escalating the doses. And the last time I did it was a 5x dose. I did feel a good boost in all those areas. I also get a cognitive boost. And that's not to imply that I felt like I was impaired cognitively, but man, I wake up and I get to work and I have these creative juices and I can write and work and get a lot done for hours. It gives me that neurological edge as well.
So going to the devil's advocate side of the conversation, could it be that there is a tolerance? I mean, that there is a dependence, even psychological, as the years go by. 5x doesn't give you a big boost. Now you need 7x. Now you need 10x. Now comes a time where you just can't function. I mean, you know where I'm going with that.
Yeah, I do. Well, I've looked at my labs too, and I think that I've kept the inflammatory markers suppressed. So what I think is I've more maintained the suppression of inflammation. Inflammation here being code for age degeneration of cells / age degeneration of parts and organs, tissues, and body. And because I've kept it suppressed, I don't get the overt feeling of amazing, of that big switch, but I'm okay with that, knowing what this is doing to me at the cellular level. So anything we can do to suppress inflammation suppresses aging of the cells. And that's why some people have taken the word inflammation and aging and put them together, and it's called inflammaging. So we're suppressing inflammaging.
So it's not surprising that when you came in after 54 years, of environmental, abuse and others, it was a big jolt. And now when you have stabilized in a good place, it's not a big jolt. Many of the things you described you felt are remarkably close to people who get extra testosterone. So since you take labs, has your testosterone level been affected by this?
Well, it's a great question. And the answer, I can't say myself because I've been on testosterone optimization for a number of years. And I prefer to treat people with these regenerative biologics who are already optimized. You're going to get more out of it if you optimize your diet, sleep, et cetera, and also your hormone status. Your cells will be more receptive to that. Your cells are starved for testosterone if you're a male, estrogen and progesterone if you're a female, and some testosterone if you're a female. And if you don't have those things, you will be more inflamed and you will age faster and not get as much out of the regenerative biologic we deliver. So I was already optimized, and I recommend anyone who's going to do regenerative biologics be optimized first.
But, there is a bit of, again, maybe it's not a controversy, maybe to the layperson like me it is, that, testosterone optimization might have an effect on the prostate, and then prostate cancer, BPH. And how does that all jive?
This actually overlaps in the men and women. There are these controversies. It turns out the latest research shows that the youthful gland, the prostate in the men, breast, ovaries, and women, these want their hormones. They want the testosterone. The prostate wants testosterone. If it loses testosterone, it looks for growth advantages to survive. It's so hungry. That's where it might form a cancer accidentally, right? It's trying to survive. And then if you give it testosterone, then those cells are already messed up and you're feeding them. The best thing you can do, it sounds, is to maintain that normal testosterone without a dip. And then you have the healthiest prostate with the least chance of a cancer formation. There, interestingly, is a treatment regimen for prostate cancer that involves high-dose testosterone. There is and has always been a high-dose estrogen treatment for breast cancer. The problem is it's not well tolerated in women because it causes significant bloating and other issues. And now we're looking back at what we thought we knew, and we were wrong. and that there is a reduced risk of breast cancer potentially if you maintain your hormone patterns the way they were when you were youthful.
So actually, this may be another boost for getting the IV stem cells, because if it's a male, you just get the IV. You don't put extra testosterone in the system. Things will normalize, hopefully, when you get the stem cells, IV. Same for the female. So you don't even have to go there in the first place to put the hormones in. You just go with the IV. Did I make sense at all here, or was I talking?
No, I would actually contradict you. I would say you'd want to optimize the hormones if needed first. I think you'll get more out of the regenerative biologic. Regeneratives themselves won't replace your hormone production.
Okay. So how can people reach you? What is your website?
Thank you so much. Our business name is Recelebrate because we're celebrating the renewal of your cells. So please contact us to recelebrate with us. And you can look us up on the web, Instagram, Facebook, LinkedIn, what have you, all with this one word, Recelebrate, RECELLEBRATE. If you go to recelebrate.com/podcast, I have an entry page for you. If you want to join our group, I'm going to start a newsletter shortly. I won't send you lots of emails. I don't have time to write them, but I will get a news on regenerative medicine, the projects we're working on in case you have interest. We'll be happy to put you on your list. You're not going to get bombarded, I promise.
Where are you located? Where's your clinic?
My clinic is in Las Vegas, Nevada in the US, but the vast majority of what I do is remote through the magic of this televideo type of presentation. We only invite people here to Nevada who are candidates. Not everyone's a candidate. If you need labs, if you need help, if you need imaging, MRIs, things, we can get that all where you live for the most part. Have them sent to us. I can look at them, share my screen with people. You don't have to come see me until it's time to come see me.
Jeff, thank you so much for taking the time. I really learned a lot. Very fascinating for what the future is going to look like, and absolutely great to know, to learn. Thank you so much.
Thank you for having me. It's my pleasure. I hope we talk again.
Take care. Same here. Bye-bye. Thanks for joining me today. Click the subscribe button for more video. Got a question or comment? I love questions and comments. Leave yours below. And here's another video you've got to see.